Surgery in the past was usually a very painful experience because of lack of anesthesia. Surgery was a last resort for people with life-threatening illnesses or diseases. Anesthesia was invented for the use in surgery in October 1846. Along with the invention and need for anesthesia, there became a need for anesthesiologists. To be a board-certified anesthesiologist in the United States takes a lot of commitment, hard work, time, and drive. The first step to becoming an anesthesiologist is to graduate high school with honors in science and math. Then you are able to move on to a 4-year college to get an undergraduate degree, preferably in biology or similar science. After college, you move on to 4 years in medical school. Once you graduate medical school, you move on to a 4-year residency program in anesthesiology. Some residencies are shorter or longer based off of certain specialties. After your first year of residency or your internship, you take an exam that tests your knowledge and capabilities from your past experiences. Then, when your 4-year residency is over, the last step is to take an oral exam, known as the oral board. After you've finished all of your schooling, exams, and practice, you are now a board-certified anesthesiologist.
Okay, I'm going to have you count down from 10.
This medication will put you to sleep now. It's going into your IV. Might burn or sting. Okay, good, they're asleep. Let's do surgery. Oh, yeah. This is a lot harder than it looks.
An anesthesiologist's job description includes administering anesthesia to patients before, during, and after surgery. During surgery, an anesthesiologist will keep track of the patient's vitals, such as their BP, heart rate, temperature, and breathing patterns, and adjust anesthesia if need be. An anesthesiologist also helps to control a patient's pain and develops a plan to keep their pain manageable. Sometimes an anesthesiologist will inject labor epidurals to moms before they give birth. An anesthesiologist will typically meet with their patients before surgery, unless it is a time-sensitive emergency, and they make and go over an anesthetic plan. She asks them health questions and develops a relationship with the patient so they feel safer during surgery. An anesthesiologist will also let the surgeon know if there are any complications that he or she should be aware of.
Doctor, the patient is hypotensive.
Okay, I will push some epi then. About 10 milligrams in his IV. Oh, that seems to be working.
Yes.
You may continue surgery.
As an anesthesiologist, you can receive lots of benefits such as affordable healthcare programs, paid leave, professional liability insurance, and a retirement program. An advantage would also be the satisfaction of helping ill or diseased people. Without anesthesia, the pain from the surgery alone could be enough to put someone in cardiac arrest and potentially kill them. The drawbacks that come with being an anesthesiologist are the crazy amounts of paperwork, the long work hours, the stressful situations, and the patients who think they know better, but actually don't. The future for anesthesiology looks promising. The population is increasing at a rate of about 1.1% each year, meaning that with more people, there comes more surgery, meaning more anesthetics and anesthesiologists. As people on Earth keep aging, they will require more surgery as well. Employment of physicians and surgeons is projected to grow 14% from 2014 to 2024, much faster than the average for all occupations.